And her face was literally being eaten away by a rare disease. Tonight, in a special Staying Healthy report, the story of a Santee mother and the doctors who helped her smile again.
Leadership that connects you to the heart of San Diego. This is 10 News Live at 5.
And her face was horribly disfigured by a rare disease. Up next, a special Staying Healthy report about face. Vicky's story.
It's a rare disease that's turned the face of a beautiful woman into something, well, somewhat disturbing to look at. Two San Diego surgeons took one look and realized they had to do something. And our cameras were there as a Santee mother of two went under a dramatic and dangerous operation to save her face.
Children are the ones that notice it the most.
I've had kids on my baseball team ask me, what's wrong with your mom? And it doesn't really make me feel good.
It doesn't take long for most people to take notice of Vicky Wiesen. Her face is literally caving in.
Her forehead is very distorted, that her eyes are uneven, and there's portions of her nose which have overgrown with bone.
I wake up crying. I'm worried that...
Vicky's face is being terrorized by an unusual cancer.
She has a rare condition called fibrous dysplasia, which is abnormal growth of the bones of the face and the skull. This is Vicky's skull. You can see the big defects here.
Vicky has already endured 2 surgeries in which doctors removed rapidly growing tumors and patched up her skull with steel plates, but new tumors developed.
And you could literally see the plate that was over here above my left eye was protruding out of my head.
How long has the vision been out? Since her last surgery 2 years ago.
Plastic surgeon Munish Batra and neurosurgeon Lokesh Tantawaya believe they can reconstruct Vicky's skull with a specially designed plastic implant.
Our plan is to go ahead and replace this whole part of the forehead.
I have to be brave.
I'm more scared than anything for my mom.
Vicky faces a very long and very difficult surgery. Doctors Batra and Tantawaya will spend the next 8 hours in the operating rooms here at Scripps Memorial Hospital in La Jolla, literally creating Vicky's new skull.
I think it's going to be sort of a technically challenging, difficult procedure.
The surgeons must protect Vicky's brain and spare her remaining vision.
So this is where the brain is hiding under. We're just trying to get the skin off the brain.
It's a delicate task with many obstacles.
It's getting tricky.
This is what Vicky's artificial skull will look like.
What we're going to be doing is replacing the base of the nose, the bones above the eyes, which are called the supraorbital rims, and then the whole forehead back.
Five weeks later, we see Vicky for the first time since her operation. She's a bit swollen, but...
When you look at her, you don't see all the deformities of the forehead. The nose looks a lot more sharp than it did. The eyes are a little more even.
These before and after pictures show the dramatic change.
I feel self-confident. And
I think she's come a long way and should continue to look better as time goes on, as the remainder of the swelling kind of settles down.
We'll go get some pizza, go bowling, go play some pool.
It's now 4 months after Vicky's surgery.
It's a miracle. To me, it's just a miracle that I even recuperated as fast as I did.
Vicky's beautiful face is restored.
I now have a new forehead.
Gone are the sunken holes, and her eyes are now aligned. She's no longer afraid to be seen in public.
I've even enrolled at Grossmont College. I'm taking 7 units starting next week. And I'm very happy about that.
Vicky's sons, Ryan and Jimmy, truly believe in miracles.
She looks really good, I think.
I'm thinking she looks great.
An amazing and brave woman. Vicky's reconstruction surgery was made possible through an organization Dr. Batra founded called DOCS, Doctors Offering Charitable Services. DOCS is made up of medical specialists who offer their services to underserved and unfunded patients in San Diego who have reconstructive needs. Scripps Memorial Hospital donated the operating room.
All I can say is wow.
Just a fabulous
It's
outcome.
amazing.
Yeah,
It
those
really is.
doctors are geniuses.
They did a great job.
Yeah.
Wow.
The FDA says silicone breast implants aren't safe to come back on the market, but others disagree. I'm Peggy Pico with that story coming up.
NBC 739 News at 4:30.
Silicone breast implants will not be making a comeback, at least not in the near future. The Food and Drug Administration has rejected a request to bring the implants back on the market. The decision comes just a few months after an FDA advisory committee recommended that the ban on silicone implants be lifted. Silicone breast implants were banned 11 years ago because of safety concerns.
Many plastic surgeons disagree with that FDA ban, saying silicone implants are safe and for years have been routinely used for breast reconstruction and mastectomy patients.
Medical correspondent Peggy Pico joins us with more on this controversial story, of course.
It's controversial because many critics, as you say, claim that the silicone implants are unsafe, even with high-tech improvements. But leading plastic surgeons disagree, and so does one San Diego woman who switched her so-called safe saline implants to silicone.
Yeah, well, they feel natural. And, you know, they drape more naturally, too.
Kimberly Sabalos switched to silicone implants 2 years ago after her so-called safe saline implants caused problems.
I became encapsulated with the saline implants.
What does that mean?
Well, scar tissue builds up around the implant, and it can get hard, and it contracts, and it was painful.
Either type can hurt, but the FDA's 11-year ban on marketing silicone in the U.S. comes from widespread complaints that leaking and ruptured silicone implants made women sick.
Understanding breast implant rupture rates, not just the rates, but also understanding what the consequences are when there is a rupture.
Some doctors say the new silicone implant is safer because it has a 3-layer shell that prevents it from leaking and stops it from rupturing even in traumatic situations.
The shell's a lot thicker and it's cross-linked in a manner such that it prevents the gel from bleeding through the implant.
Board-certified plastic surgeon Munish Batra prefers silicone implants and says so would most of his patients.
And if they have thin skin, they'll see the rippling, and that's of course distressful to them. Whereas with the gel implant, same size implant, there's no rippling because the gel's more viscous and it fills out those ripples.
The FDA allows silicone for breast reconstruction in cancer patients and for women like Kimberly who've had problems with saline in the past.
I don't understand it. I don't understand how can you give a woman who's had cancer and had a mastectomy silicone implants, and that's fine, but not someone who's perfectly healthy.
It's a question many women and doctors want the FDA to answer. Silicone is used in breast implants in many countries, but today the FDA said it wants more information before it will allow silicone implants to be used once again cosmetically here in the U.S.
So it could be more to come, I suppose.
There will be more to come, I'm sure. People will be battling this for a while.
Okay. Thanks a lot, Peggy.